And welcome to Dr. B Talks About Ear Tubes with me, John Burgoyne. I'm an otolaryngologist practicing in Austin, Texas with over 30 years experience dealing with ear, nose, and throat problems. And today we're going to talk about ear tubes. This is specifically for you if you have been told that you, or perhaps your child, needs to have what's called a myringotomy with tubes, and you don't really understand what exactly tubes are and what they're for. So what does myringotomy and tubes mean? Well, a myringotomy just means make a hole in the eardrum. So myringotomy and tube means make a hole in the eardrum and put a tube in it. So that's the basics of it, but let's get into it a little bit more. First of all, what do tubes look like? There are actually a whole bunch of different tubes. Here, as you can see, there are a whole bunch of different shapes and things about them. And they actually have been around a long time. In the mid-1800s, they were made of gold or silver or rubber or even glass. And they were thought to be mostly to try to treat the recurrent infections that were causing horrible, they called it brain fever, and was a way to try to keep the eardrum open. Well, that is still their purpose, but with the advent of antibiotics, it's not so much as trying to prevent their terrible complications as to prevent the milder complications of ear problems. Anyway, now they're usually made out of plastic, titanium, or stainless steel. The different shapes are to try to make them stay in longer or shorter periods of time. The little tubes get expelled by the ear more quickly. The tubes with these giant flanges tend to stay in a little bit longer, but they're all basically doing the same thing. Now you say, oh, that's a lovely picture, but what do they look like in real life? Well, here's a picture of kind of a regular tube sitting on my hand. So you can see they're not very big. Let's zoom up on it a little bit closer, and you can see that this tube, which is called a bobbin because it looks like a bobbin, is one of the more common types of tube. It's just a small, little tiny tube with a hole through the middle of it and a flange on each side that we fit into the eardrum. So that's what they look like, and that's kind of the size that they are. But what do they actually do? Well, as I said, the original idea was to permanently drain fluid. You can drain some fluid out of a tube, but really what we think about them now as doing is bypassing the eustachian tube. The eustachian tube is what connects the middle part of our ear to the back of our throat. It's where there's air that you have to equalize when you go up and down a mountain or up and down in an airplane. And ear tubes basically bypass the eustachian tube and ventilate the middle ear. The actual official name for an ear tube is a pressure equalizing tube. So it's not a fluid drainage tube, it's a pressure equalizing tube. So as I say, the middle part of the ear connects through what's called the eustachian tube into the back of the nose. Little kids tend to have more trouble because infection can go up through the tube into the ear. That infection can then cause swelling of the tube and block it off, and the ear fills up with fluid. Other things can cause this same sort of thing to happen. And in fact, anything that makes a problem with the eustachian tube can cause there to be a negative pressure in the ear, which will then make it fill up with fluid. Basically, the negative pressure just sucks the fluid out of the tissues and fills it up with fluid. So if we can put a hole in the eardrum so that air can come in and out, even if this is completely blocked, it works. So that's the main purpose of having a tube, is to allow air to be in here and ventilate the ear. Well, what's the process of putting a tube in? First of all, we have to have some sort of anesthesia. That can be topical, and in most of my older kids and adults, this is something that I do under topical anesthesia. I put a drop of numbing medicine on the eardrum, it numbs it up when we get to do it. Younger kids who won't tolerate being still for that, we sometimes do a local anesthesia, which we put in with a machine that usually kids from, some 4-year-olds on up are able to use to get local anesthesia, and it's okay for them to kind of squirm and be moving around while that happens, and so they're able to do it. But little kids and a lot of medium-sized kids, we put them asleep to do this. So let's assume for a minute we're going to do a topical anesthesia, as I do for older children or adults. Basically, we put a drop of this stuff on the eardrum, and you get a white spot that's numb. I've had this part done myself several times, and it burns for about 5 seconds. So you put a drop on it, and oh, it's terrible for about 5 seconds. And then after that, it's completely numb. So after you have your numb spot, you just make a little tiny slit. Remember what size that tube was. We make a little tiny slit, and then we pop the tube in by sticking its flange through the hole, and then it sits there right in the eardrum, as is shown here. Well, what happens after that? So there are a few things we have to think about. We think about giving you eardrops for a few days, particularly if there is an infection. Then eardrops can be very helpful. Studies don't actually show that in the absence of infection they do anything, but most doctors will have you take eardrops for a few days just to make us feel better. Not sure it helps, but it's one thing that we do. We also think about antibiotics. If there's an acute infection, then we give antibiotics. Usually, unless there is an acute infection, though, we don't. And the other thing we have to think about is water. If you have a hole in the eardrum because you've got a tube in there, you think about whether there need to take any water precautions. Studies don't actually show that avoiding swimming is important. Most of us are a little uncomfortable if you're going to be in dirty water like ocean water or lake water and have you wear an earplug to prevent water getting in. Because obviously if water goes in and it has bacteria in it and it gets into this part of the ear, you could cause an infection. I don't believe that swimming in a regular pool, unless you go more than 4 feet deep, is a problem at all. And that's what I tell my patients. How long do tubes last? Well, again, that gets into this sort of thing. These big, long flanges, you might expect, will hold it in the eardrum a lot longer than these little tiny nubbins. But generally speaking, tubes will stay in these smaller type somewhere around 6 months, meaning 4 months to 12 months. These may last for several years, and the ones that are kind of in between with different sizes of flanges are kind of in between on that. So they come out on their own. They really don't ever go in the wrong way. They always come out. It's the way the ear heals. If they did go in, it's because somebody perhaps made a little bit too large of a hole or something else happened, but they don't go in. They always come out. When you look at this, the eardrum heals by growing from the outside out, and basically it'll push this ear tube closer and closer to the edge, and it almost trips before it comes out. And so that depends on it. And look how far this is. There's no way that you could put your big fat finger in there and touch it. Most wax is out here. Hearing aids only go in about this far. Headphones only go in about this far. None of those are a problem. The only thing I really don't let my patients do that have tubes is scuba dive. That's just too much pressure change, and that you're going to be able to force fluid or air through the tube that you don't want to have to deal with. So that's the only thing I have to do. So that's it. That's what tubes are. That's what they're for. I need to remind you that Dr. B Talks About is presented for information and enjoyment, and really this is entertainment. This is not treating any medical condition. This is, if you think you have a problem that might require tubes, go talk to your doctor. If you're in the Austin area, come see me. I'd be happy to see you. Just Google me and you'll find me. And remember, no matter what else you do, push the button, like my video, share it, subscribe to my channel, and check out my other Dr. B Talks About videos. Thank you so much.